Hey, you respiratory instructors out there. This is Dennis Stanley, president of Lindsay Jones University. I'm actually in Japan. You have to forgive me. I'm traveling. As you might know, you probably know that I speak Japanese. I like all things Japanese. In fact, if you don't know this, let me just tell you that one thing that you'll want to turn your students on is to a YouTube channel called Respiratory Sensei. It kind of mixes the Japanese world, but also with the respiratory world, and there they'll find all kinds of free stuff. It's acclimated really towards students and brand new therapists who are trying to learn the craft, get ready for the exam, and just kind of be new in the field. But check it out, it's called Respiratory Sensei, and it's on YouTube. But what I wanted to do was to update you on what we know about the NBRC exam. We just had the summer forum, and what did we learn from that? The NBRC did present there. Well, the answer really is that we didn't learn all that much. That's kind of typical. We did learn a few things. I definitely want to share that with you and how we're folding it into what we're doing at Lindsay Jones University. But of course, as you might imagine, the NBRC definitely has the task of trying to validate the legitimacy of students who are trying to take the test and become part of our field. And you know, a lot of people don't realize this, but the NBRC, and I mean this with all due respect, they're not the entity that represents our profession. The AARC is, but the NBRC actually represents the consumer. And so on the bottom line is that they're trying to protect the consumer, the healthcare consumer, from us, or rather from any respiratory therapist that becomes a therapist too easily, but they're really not ready to take care of patients. And so they have that task, and therefore when they talk about the exam, they want to tell you what we're doing, what they're doing, so that they feel responsible, so that you know where they're going generally, but they can't give you so much detail that they make it easier for the students to take the exam. Now, whether that's right or wrong, that's something that you can judge. But our job, of course, is to stand in the middle there and try to bring in a little bit more information, a little more context, a little more understanding, so that the therapist can actually prepare. Our belief generally is that the therapists who are completing 2 years, who've done clinicals, who've been really responsible, they're certainly ready. They just need to pass the test. They need to demonstrate critical thinking, and that's really what we teach on the exam. But here's the main thing we learned from the NBRC, and it's a little bit rainy out here, so Japan's a very wet place if you can't tell. I have a temple behind me, one of many. They're just kind of everywhere, and I have lived here before. But in fact, you can follow me on Respiratory Sensei. I'm dropping a couple of short videos every day about Japan. But anyway, but yeah, so what they said, what they have here on the examination is they're testing 2 areas: breadth of knowledge and, of course, clinical judgment. Now, the breadth of knowledge is probably going to be very similar to what we know as application and patient data, recall, those types of things, equipment, a little bit about equipment. So that's just going to be their general knowledge, some of it memorized or very simple applications. But then remember, they're taking away the clinical simulations, and that's where the critical thinking, the real interventions, and the analysis was occurring. What they figured out is with the analysis questions on the examination, the RRT examination, the multiple choice, I should say, that it was a very good corollary with people who had passed the clinical sims. In other words, if they passed the analysis questions on the multiple choice, then they were very likely to pass the clinical simulations as well. And so with that corollary, they decided to let the clinical simulations go by. But here's what they're doing, and here's what they said at the forum. And this is interesting. They say that the student is going, the test taker, I should say, is going to be reading a lot more. What do they mean by that? Well, you know, in a clinical simulation where we fold out kind of a whole case, maybe a whole paragraph there, it's more than just a simple question. We think they're probably headed toward doing that on the exam as well. We're pretty sure they are. So a question might be very, very long. It might give the context, the story, lots of data, different data points. And then the student's going to have to analyze that, decide what's important, bring it together, synthesize, decide what's wrong, and then maybe make the decision on what to do about it. Now, this is interesting. And what we wondered is 2 things, but the NBRC is denying it so far. We'll watch it very closely. We wondered if they were going to give a scenario that's complex and then allow multiple questions to be asked about that scenario, kind of like a clinical simulation, but they say they're not going to do that. The other thing that we've asked is it really truly going to be multiple choice, and will there be any complex questions that are more than just A, B, C, D offered? Will they offer more than 4 options? They also also deny that they're going to do that either. So they're saying that in the end, it's still going to just come down to a multiple choice, but they're going to be reading more. We think that's going to be in this scenario. So we'll be able to fold that into what we're doing at Lindsay Jones University as well. We're already working on that. We're super excited. We've already just finished the patient data chapter. We're taking kind of an interesting different approach. We also have a different approach to pharmacology, so that's going to be interesting. Now, I've addressed this before, but the nagging question on everybody's mind is, how do you time the change of the material for your group? And maybe you have a couple of cohorts, one of which could and should take the current exam, but you're worried that they might little bit too much time go by and then need to take the new exam. And what do you do? Well, at Lindsay Jones University, what we're doing is allowing you as coordinators and instructors to choose when you migrate to the 2027 material. Now, I can't promise this, but this is what we're really looking into. Just to give you a little bit of a secret here, is what we're really looking into is allow you to migrate per student and not just for the whole group. Minimally, we think we might allow you to migrate per cohort, and that would make sense. So if you have a brand new school class that's beginning, cohort that's beginning, maybe they've done 6 months, and you know for sure they're going to graduate in 2027 or beyond, then you're going to put them on the 2027 material. It's just going to be a flip of the switch on Lindsay Jones University. You have control over that. But then again, the other ones, then you can keep on the old material. But if a student calls up after school, because their account usually goes beyond graduation, says, I'm not going to be able to take the test this year, and they're going to take the 2027 stuff, then you can kind of get on there and you can flip them or we can flip them over to the 2027 material. So at all times, their information stays pertinent. Anyway, that's just a little bit of a taste of what's going on. So this is Dennis. I'm the president of Lindsay Jones University. If you don't know about Lindsay Jones University, you need to call us. We're getting better and better at it. We're not perfect. We try to be, but we're always working on stuff. We always have a question that we're trying to make better, or some student finds some flaw in a question, so we have to change that. That's just kind of the way it is. We have thousands of questions, so we're always working on that. But we are excited about what's going on. And if you want to know more, you can call Laura at Lindsay Jones, and she'll not only give you a tour by Zoom, but she can even turn the account on and just let you play with it, or even let your students actually play with it for a week or two, just so that you can get some feedback from them. And it's pretty amazing. We're looking forward to 2027. It should be exciting. We're looking forward for our field to go forward. There's one other plug I got to tell you, and that is in October. More information's coming now, but I have agreed to present for the AARC at the Next Gen RT conference. If you don't know, I grew in respiratory therapy to where I started working in hospital administration. I've been over most clinical departments of a hospital. How'd that happen? And what I'm going to be speaking on is how to come straight out of respiratory school for your students or people who've been in the field for a year or two and are interested in leadership. What do they need to do to become a leader in respiratory therapy? And that's an interesting subject. You know, it's not just education, it's also how do they influence those around them so that they become informally seen as leaders, and then of course how do they formally get the leadership positions. Respiratory therapists should definitely be leaders because we are taught to critically think. So I'm a strong advocate of that. Anyway, so I'm Dennis with Lindsay Jones. I'm in Japan right now. Please follow me on Respiratory Sensei if you want to keep up with me in Japan. I'll drop a couple of shorts every day, but also stay here and I'll keep letting you know the NBRC 2027 pathway and our preparations for that so that we're effective. We'll see you later.